Welcome to Crack Surgery YouTube channel. In this video we are going to study removal of sutures materials according to time. Before proceeding, please subscribe to my channel. Sutures are small string, wire, or other material used to sew together body tissue and skin. They can be placed deep and/or on the surface of tissue to close wounds. Sutures can be absorbable or non-absorbable. Non-absorbable sutures are usually removed within 7 to 14 days. Suture removal is determined by the extent of wound healing and surgery. Sutures should be left in place long enough to create a wound closure with sufficient strength to support internal tissues and organs. The surgeon should evaluate the wound and decide whether to remove the sutures. The wound line should also be observed for detachment during the suture removal process. Alternating sutures, every other suture, are usually removed first, and the remaining sutures are removed once the appropriate approximation of the skin tissue is determined. Once the wound has healed well, remove all sutures at the same time. Now we are going to discuss when to be suture removed. Sutures taken over eyelid, lips and face should be removed within 3 to 4 days. Sutures taken over eyebrows and nose should be removed within 3 to 5 days. Sutures taken over scalp should be removed within 6 to 8 days. Sutures taken over chest and abdomen should be removed within 8 to 10 days. Sutures taken over ear and hand should be removed within 10 to 14 days. Sutures taken over back and foot or sole should be removed within 12 to 14 days. Thank you so much for listening and please subscribe to my channel. Have a good day.